Hi, I'm Andrew Grecki, physical therapist at Superior Physical Therapy, and we are the lumbar stenosis specialists. And I'm here today to share with you information on what stenosis is, and also how to perform a 30-second self-test in the safety and security of your own home. This test will give you information on whether or not you have the condition called stenosis. It also might be called degenerative disc disease or lumbar arthritis. We know that individuals over the age of 55 years old that have pain in their lower back with walking that goes away with standing have a 97% chance that they have stenosis when their back hurts. So I'm here today to share with you a quick test and hope you enjoy. In this diagram you can see that where the nerve comes out of the spine itself, there's a bony hole, and clearly in this picture that bony hole is more narrow, which means stenosis, as well as getting compressed and irritated. And so as we age, oftentimes that arthritis or that narrowing happens, and it can compress that nerve and cause sciatic pain that shoots down the leg, numbness and tingling or weakness. This is a 30-second self-test for lower back pain, specifically stenosis, which is arthritis or narrowing in the holes where the nerve comes out of the lower back. I'm going to show you two parts to this test. The first one is to determine whether or not you have stenosis. The second part is to help you figure out if you have the most common cause of pain because of stenosis. Research indicates that there are three main factors that would give you a 97% chance of having stenosis. One, you're over the age of 55. Two, you have lower back pain with standing or walking. And three, it goes away with sitting down. That says right there that 97% likely you have stenosis. My lovely wife Erin is going to be our model. I want you to turn to the right. Very simple test. I just want you to extend backwards. Just reach back. Try that 3 times. Yep. Good. If there's lower back pain or any sciatic pain down the legs, that is a very strong indicator we have stenosis. Now, the second part of this test is going to help us determine whether our hip mobility is contributing to the pain that we experience because of stenosis. You can have stenosis without pain. What I want you to do now is, let's say that when Erin did that position, her left side hurt. I want you to put your left foot forward and your right foot back. And now try that test again. If she can do this and the pain goes away, this is a very strong sign that the left hip tightness is contributing to the pain. Now, this would confirm that. Switch your feet. And again, let's try that again. If that pain returns or gets worse, we know that the front of this left hip being tight in the hip flexor region can contribute very commonly to stenosis pain. Well, you've done the test, and you may or may not have symptoms that show that you have stenosis. But I want to say first and foremost that it's important for you to know that we're here to help you. There's no reason that somebody should have to live with stenosis. It can be a very debilitating condition that affects every part of your life. And it's important to know that physical therapists at Superior Physical Therapy specialize in treating patients with stenosis. So if you're interested today in finding a real solution to your pain, please give us a call at 944-6541 today. If you're not ready to make an appointment, we understand. That's why we've put a lot of resources on our website that include the top 3 exercises for stenosis, as well as an ebook that we've published that has information that's available to download for free that can describe in more detail what stenosis is and what to do about it. We hope you enjoyed our 30-second self-test, and again, we hope you find a real solution.